Discover the terrible consequences of dementia and how to prevent it. Have you ever wondered if those frequent forgetfulness episodes are normal? Or if difficulty remembering names and appointments might be a sign of something more serious? Could mood changes and disorientation in familiar places indicate the onset of a more severe condition? The early symptoms of dementia are often subtle, easily mistaken for natural aging. How can you tell if difficulty planning or solving everyday problems is just a phase or something to be investigated? The key is to understand that these small changes, like forgetting important events or repeating questions, can be the first signs of dementia. Disorientation in familiar places, difficulty finding words during conversations, and even mood and personality changes like depression or anxiety are indicative and deserve attention. Are you or a loved one showing these symptoms? Stay with us until the end to understand more about how to detect and deal with these early signs before it's too late. Important: we have listed all references used to create this video in the description for you to access anytime you want. Let's get started. Discover the terrible consequences of dementia and how to prevent it. Early symptoms of dementia, you might be ignoring them. The early symptoms of dementia can be subtle and easily mistaken for normal aging. Among the first signs are recent memory loss, such as forgetting important events or repeating questions. Difficulty planning or solving simple problems, like following a recipe or managing finances, is also common. Disorientation in familiar places and trouble finding the right words during a conversation are concerning signs. Mood and personality changes, such as depression, anxiety, or apathy, can appear. Visual perception may be affected, making reading or assessing distances difficult. These initial symptoms can vary in intensity and frequency, but it's essential to seek a medical evaluation upon noticing these changes. An early diagnosis allows for interventions that can slow the progression of dementia and improve the quality of life. Early detection is crucial for planning for the future and seeking adequate support. Dementia versus Alzheimer's. What's the difference? Find out now. Dementia is a general term used to describe a range of conditions that affect a person's memory, thinking, and social skills, significantly interfering with daily life. Dementia is not a specific disease, but a group of symptoms associated with various conditions that cause cognitive decline. The most common causes include Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Alzheimer's disease is the most common form of dementia, accounting for 60% to 80% of cases. It is characterized by the formation of beta-amyloid plaques and tau tangles in the brain, resulting in the progressive loss of brain cells. While dementia can be caused by various conditions, Alzheimer's is a specific disease with its own pathological mechanisms. Understanding this difference is essential for proper diagnosis and treatment. Early recognition and correct symptom management can significantly improve patients' quality of life. How Alzheimer's starts, the signs no one tells you. Alzheimer's begins insidiously, with mild symptoms often attributed to normal aging. Initially, the person may experience frequent forgetfulness, especially regarding recent events or newly learned information. There may be difficulty finding words, naming objects, or remembering the names of familiar people. Judgment and decision-making abilities begin to be compromised, and everyday tasks, such as managing finances or planning a trip, become challenging. Over time, symptoms progress to disorientation in time and space, causing the person to get lost in familiar places or forget important dates. Mood and personality changes are also common, with the individual becoming anxious, confused, or even aggressive. As the disease advances, independence is lost, requiring constant assistance with daily activities. The progression of Alzheimer's varies from person to person, but the impact on daily life is inevitable. Hidden risk factors that increase the chances of dementia. Various risk factors can increase the likelihood of developing dementia. Advanced age is the most significant risk factor, with the condition's prevalence increasing significantly after 65. Family history and genetics also play an important role, especially in the case of Alzheimer's. Lifestyle factors such as sedentary behavior, poor diet, smoking, and excessive alcohol consumption are known to increase the risk. Chronic diseases such as hypertension, diabetes, obesity, and cardiovascular diseases are also associated with a higher risk of dementia. Additionally, traumatic brain injuries and low levels of education and cognitive stimulation throughout life can contribute to the disease's development. Identifying and modifying these risk factors can be crucial in preventing or delaying the onset of dementia. Adopting a healthy lifestyle and monitoring pre-existing medical conditions are essential steps in reducing the risk. The first symptoms of dementia. Identify them before it's too late. The first symptoms of dementia can be easily overlooked or mistaken for normal aging changes. Memory loss is one of the most common signs, especially concerning recent events. The person may forget appointments, frequently lose objects, and repeat questions or stories. Difficulty planning or solving problems is also an early sign, as well as disorientation in time and space, which can cause the person to get lost in familiar places or forget important dates. Mood and personality changes, such as depression, anxiety, irritability, and apathy, are often observed. Difficulty following conversations, finding words, or understanding visual information may also occur. These initial symptoms should be monitored and evaluated by a healthcare professional for early diagnosis and appropriate intervention. Early detection is crucial for improving the quality of life of the patient and their caregivers. Be surprised. Causes and types of dementia explained. Dementia can be caused by various conditions that affect the brain. Alzheimer's disease is the most common cause, responsible for most cases. It is characterized by the formation of beta-amyloid plaques and tau tangles in the brain. Vascular dementia is the second most common cause, and results from damage to the brain's blood vessels, often following a stroke or a series of small strokes. Lewy body dementia is caused by abnormal protein deposits in the brain, leading to symptoms such as visual hallucinations and motor problems. Frontotemporal dementia involves the degeneration of nerve cells in the brain's frontal and temporal lobes, primarily affecting personality and behavior. Other causes include neurodegenerative diseases, such as Parkinson's disease, infections, and traumatic brain injuries. Understanding the different causes and types of dementia is essential for proper treatment and management. The therapeutic approach may vary depending on the underlying cause. Natural prevention of dementia, the secrets you need to know. Preventing dementia naturally involves adopting healthy habits throughout life. Maintaining a balanced diet rich in fruits, vegetables, whole grains, fish, and healthy fats can promote brain health. Regular physical exercise such as walking, swimming, and aerobic activities improves blood circulation and helps keep the brain active. Continuous mental stimulation through reading, puzzle games, learning new skills, and social activities can slow cognitive decline. Controlling chronic conditions such as hypertension, diabetes, and high cholesterol is essential for brain health. Avoiding smoking and excessive alcohol consumption is also crucial. Getting enough sleep and managing stress through techniques such as meditation and yoga can benefit brain function. Adopting these healthy habits early on can significantly reduce the risk of dementia. Natural prevention is an effective approach to maintaining long-term cognitive health. Powerful foods to boost your memory. Certain foods are known to benefit memory and cognitive function. Fatty fish, such as salmon, sardines, and mackerel, are rich in omega-3 fatty acids, essential for brain health. Berries, such as strawberries, blueberries, and raspberries, contain antioxidants that combat oxidative stress and inflammation in the brain. Nuts and seeds, especially walnuts, almonds, and chia seeds, provide vitamin E, which protects brain cells from damage. Leafy green vegetables, such as spinach, kale, and broccoli, are rich in nutrients like vitamin K, lutein, and folate, which promote brain health. Avocado is a good source of healthy fats that help maintain brain function. Regularly consuming these foods can improve memory and long-term cognitive health. A diet rich in essential nutrients is fundamental for preserving cognitive functions. The most beneficial fruits for your brain. You will be surprised. Fruits are an excellent source of nutrients that can benefit the brain. Berries, such as blueberries, strawberries, and raspberries, are rich in antioxidants that protect the brain from oxidative stress and improve neuron communication. Oranges are an excellent source of vitamin C, which has antioxidant and anti-inflammatory properties, helping to protect the brain from damage. Bananas, rich in potassium and vitamin B6, help produce neurotransmitters essential for cognitive function. Avocado, though technically a fruit, is rich in healthy fats that promote brain health. Apples contain quercetin, an antioxidant that can protect brain cells from damage. Including a variety of these fruits in your diet can significantly contribute to brain health. A diet rich in various fruits is essential for proper cognitive function. Antioxidant and anti-inflammatory foods. Protect your brain now. Antioxidant and anti-inflammatory foods are essential for brain health. They help combat oxidative stress and inflammation, which contribute to cognitive decline. Among the most effective antioxidant foods are berries, such as strawberries, blueberries, and raspberries, which are rich in flavonoids. Leafy green vegetables, such as spinach and kale, contain antioxidants like vitamin C and beta-carotene. Nuts and seeds, especially walnuts and sunflower seeds, provide vitamin E, which protects brain cells from damage. Omega-3 rich foods, such as fatty fish, help reduce inflammation. Turmeric, known for its active compound curcumin, has powerful anti-inflammatory and antioxidant properties. Incorporating these foods into your diet can help maintain brain health and prevent neurodegenerative diseases. A balanced and nutrient-rich diet is crucial for protecting cognitive functions. Coffee and its surprising benefits for the brain. Coffee can be a powerful ally for brain health. Studies show that moderate coffee consumption is associated with a lower risk of neurodegenerative diseases, such as Alzheimer's and Parkinson's. The caffeine in coffee increases alertness, improves mood, and can enhance short-term cognitive function. Besides caffeine, coffee contains antioxidants and other bioactive compounds that have beneficial effects on the brain. These compounds help reduce inflammation and protect against oxidative stress. However, it's important to consume coffee in moderation, as excessive intake can lead to side effects like insomnia and anxiety. 3 to 4 cups a day are generally considered safe and can provide significant cognitive benefits. Integrating coffee into your daily routine, with balance, can be a simple and effective strategy to maintain brain health and cognitive function. Amazing habits to treat dementia. See how. Adopting healthy habits can be a powerful approach to treating and managing dementia. Maintaining a balanced diet, rich in essential nutrients, is fundamental for brain health. Regular physical exercise improves blood circulation and promotes neuroplasticity. Continuous mental stimulation through cognitive activities, such as reading, puzzle games, and learning new skills, can slow cognitive decline. Participating in social activities and maintaining strong social connections is also crucial, as isolation can accelerate dementia progression. Controlling chronic diseases, such as hypertension and diabetes, helps reduce the risk of complications. Stress management techniques, such as meditation and yoga, can improve mental and emotional well-being. Adequate sleep is essential for brain regeneration. Adopting these healthy habits can not only slow the progression of dementia, but also significantly improve the quality of life for patients. How to sleep better and protect your brain. Essential tips. Sleeping well is crucial for brain health and dementia prevention. During sleep, the brain performs essential memory consolidation and repair processes. Sleep deprivation is associated with an increased risk of developing dementia and other neurodegenerative diseases. To improve sleep quality, it is essential to maintain a regular sleep routine, going to bed and waking up at the same time every day. Creating a sleep-friendly environment with a dark, quiet, and cool bedroom is also important. Avoiding electronic devices before bedtime can help, as the blue light emitted by screens can interfere with melatonin production, the sleep hormone. Practicing relaxation techniques, such as meditation or deep breathing, can facilitate falling asleep. Limiting caffeine and alcohol consumption in the hours leading up to sleep is also beneficial. Adequate sleep is one of the most powerful habits for maintaining cognitive health and preventing mental decline. Secrets to keep your mind active and sharp. Keeping the mind active is essential to preventing dementia and promoting brain health. Activities that challenge the brain, such as reading, puzzles, strategy games, and learning new skills, can improve neuroplasticity and slow cognitive decline. Studying a new language or playing a musical instrument are effective ways to stimulate the brain. Participating in social activities, such as book clubs or discussion groups, can also keep the mind engaged. Additionally, regular physical exercise has shown benefits for cognitive function, as it improves blood circulation in the brain and stimulates the growth of new brain cells. Staying mentally active throughout life is a powerful strategy to protect brain function and reduce the risk of dementia. Integrating these activities into daily life can significantly contribute to mental and cognitive health. Meditation, a powerful weapon against dementia. Meditation is a powerful practice for improving mental health and reducing the risk of dementia. Studies show that regular meditation can increase the thickness of the cerebral cortex and strengthen connections between neurons. This can result in better memory, concentration, and overall cognitive function. Meditation also reduces stress and anxiety, which are risk factors for cognitive decline. Practicing mindfulness meditation, which involves focusing on the present moment, can help improve attention and mental clarity. Additionally, meditation can promote better sleep, another crucial factor for brain health. Starting with just a few minutes a day and gradually increasing the time can be an effective way to incorporate meditation into your daily routine. The benefits of meditation for brain health are numerous, making it a valuable practice for dementia prevention. Social connections, a shield against dementia. Connecting socially is fundamental for brain health and dementia prevention. Participating in social activities such as community groups, clubs, or social events can keep the mind active and engaged. Social interactions stimulate the brain, promoting neuroplasticity and reducing the risk of cognitive decline. Maintaining strong relationships with friends and family is also crucial, as emotional support can reduce stress and anxiety. Volunteering in your community or participating in group activities can provide a sense of purpose and belonging. Studies show that socially active people are less likely to develop dementia compared to those who are isolated. Additionally, socialization can improve mood and quality of life. Integrating social activities into your daily routine is a powerful strategy to protect brain function and promote mental health. Powerful supplements and vitamins. To improve memory, supplements and vitamins can play an important role in maintaining brain health and improving memory. Omega-3, found in fish oil supplements, is essential for cognitive function and brain health. Vitamin E, with its antioxidant properties, protects brain cells from damage caused by oxidative stress. Vitamin B12 is crucial for neurotransmitter production and neuron health maintenance. Folic acid and vitamin B6 are also important for brain function and can help improve memory. Choline, found in soy lecithin, is essential for forming acetylcholine, a neurotransmitter related to memory. However, it is important to consult a healthcare professional before starting any supplementation, as individual needs may vary. Integrating these nutrients into your diet can help maintain cognitive function and memory. Ginkgo Biloba, the natural supplement for the brain. Ginkgo Biloba is a plant widely known for its benefits to brain health. Its extracts are often used in supplements to improve memory and cognitive function. Ginkgo Biloba contains powerful antioxidants that protect brain cells from damage caused by oxidative stress. Additionally, it improves blood circulation in the brain, which can increase the supply of oxygen and essential nutrients to neurons. Studies suggest that Ginkgo Biloba can help improve memory, concentration, and mental clarity, especially in older individuals. Some researchers also believe it can slow cognitive decline in patients with dementia. However, it is important to remember that effects may vary from person to person, and consulting a healthcare professional is recommended before starting any supplementation. Ginkgo Biloba is a promising natural option for brain health. A message of hope for Alzheimer's patients. Dear Alzheimer's patients, you are strong and courageous. And remember that you are not alone in this journey. Accept the support of your loved ones and caregivers. Keep fighting, one day at a time. The diagnosis is not a death sentence. Continue living. They may not remember what was said 5 minutes ago, but they are still capable of feeling love, joy, and enjoying life. These people are much more than what they can remember. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.